I'm Dr. Anthony Maloof, and we're going to meet tomorrow, and you're going to have keyhole watery eye surgery. So I thought I'll bring you up to date on a couple of things that will happen. Before you get into the operating theatre, the nursing staff will spray your nose with that nasty, horrible tasting stuff. Yes, I've sprayed it in my own nose, and it's very important for surgery. It actually decongests your nose and allows me to look in. That's the first thing. When you get into surgery, you will be having surgery under general anaesthetic, which means you'll be asleep and you won't feel anything, and that's great. When you wake up, you will find your vision a bit blurry. That's because we put protective ointment in your eyes. So don't be scared, you haven't lost vision. A few blinks and it will slowly improve. The second thing you'll notice is you might find an ache just here between your eyes. That's normal. 90% of people say no pain, just ache, and the ache is normal. That's because I do a lot of work inside your nose. Don't be alarmed. You might find a little bit of blood trickling into the back of your throat. That usually settles very quickly. Don't be alarmed. If you do feel like spitting it out, spit it out because it can make you feel sick. But in general, it should be minimal. Finally, there'll be a little string to the side where the pack inside your nose is held in place. Leave it there, don't pull it out because I need that pack. It holds everything in place so it sticks down nicely the way we want. Sometimes there's a little dressing over the top we call a bolster, and you can remove that when you get home. I'd ask that you take it easy after surgery. Don't begin the rinses or the sprays until we take the pack out of your nose. So don't begin it. Once we take it out, then it's over to you. You've got to do it, the rest of your stuff. Rinse the nose, use the sprays as we instruct. Have a look at the video here if you want to see the link now. And that's important. It's like you finishing off my surgery so you get the results. If you have any queries, as always, contact us. I hope this has helped you through it. I'll see you tomorrow.